Now, doc, regarding the condition which is being shown to you, now you can see that there is a fracture, dislocation, there is a dislocation. So, looking at it, first of all, what is this fracture? It's an acronym associated fracture. So, what is the fracture you should identify? And then you should be in a position to tell a correct answer about it. Question number 13. Yeah, should you answer, doctor? Question number 13. Let me get question number 13. Ranjit Shaw is proposing B. Badhiya? Ranjit Shaw is proposing B. Yes. 13. Madhu thinks B. Radhika thinks B. Amrita thinks B. Badhiya. No, doc. It is interosseous membrane tear with a triangular fibrocartilage complex tear and a radial shaft fracture. This is a Galeazzi fracture. That's what you need to basically remember. Galeazzi fracture जो होता है lower part of the radioulnar area में रहता है, right? Upper part में होने वाला Monteggia is the fracture, is what you need to understand. Now, doc, a 75-year-old male after a fall in the bathroom had hip dislocation, which is being shown to you, right? Now, hip dislocation को दिल लगा के देखो. Now, what will be the position, attitude of his limb is a very important question. Question number 14. What is your answer, doctor? So, what will be the attitude? So, every day we will have about 20 to 30 image-based questions, and that should be sufficient, enough of a visual image-based questions examiner is going to give you. B. Cole is saying C, Deepika is saying B, and Madhu B, Parkin B, Mangesh Shinde B, Rajadurai साहब आप ऐसा मिस्टेक मत करो, ये posterior dislocation नहीं है, anterior dislocation है राजा साहब. इसके पहले बहुत अच्छा आंसर दिया, no problem. So कभी कभी सिक्सर, कभी कभी no sixer. Very good. Radhit Shaw thinks anterior dislocation. He thought it correctly, but answer was wrong, right? So shortening, abduction, external rotation, that is what anterior dislocation is all about. So, doc, you should remember that if there is any posterior dislocation, right? Posterior dislocation, let me take a white colored pen, right? So, if there is any posterior dislocation, then there is a shortening, internal rotation, and adduction, and knee in the slight flexion. So this is the classical appearance which you should not basically miss. So anterior dislocation जो होता है, in this typically you get minimal flexion, external rotation, and marked abduction. So that is the typical attitude in anterior dislocation, is what you have to basically remember. Now, doc, what is the most common sequelae of the trauma which is being shown to you here? In a trauma, this is a radiograph. So, in a young adult with the following radiograph, what is the most common sequelae of the trauma is my question to all of you. Should you answer, doctor? Question number 15. Yes. That's right. Radhika Pillai rightly says Fadil, flexion, adduction, internal rotation in posterior dislocation. Ranjit Shaw, Jindabad, recurrent shoulder dislocation is going to be the most common sequelae, if there is shoulder dislocation, young adults is what you should remember. Now, what is the management of the fracture which is being shown to you in this? So, this is a fracture. So, what is the most common management is the question of the examiner. Good. So, Amrita Francis is proposing tension band wiring. Excellent, excellent. Earlier we had this question, Madhu, you cannot do wrong. I think Madhu said for the old question. Last question she said B. Okay, okay. Brahma Tirtha Chitar Vedi also is proposing tension band wiring. Absolutely right. Now, which movement of the hip is being examined by the examiner? So you are doing the clinical examination. So looking at this, tell me, which movement of the hip is being demonstrated by the examiner in the following illustration is the question. Yes. Question number 17. So, very good. I'm so happy. 70 online students, and by the time it is night, if we leave the video in the YouTube, I'm able to see about 600-700 students having reviewing the video. Very good. But I cannot be able to leave that like that. I need to delete the video and upload it into our video library so that the students can take admission. So someone was telling me, sir, aap ye free classes band karo, otherwise students don't join and in the subscription. But that I never agree, right? So this live online interactive session is like a starter for you, and the actual food is there in the onlinembbs.com video library. But the problem is, to eat that food, you need some amount of appetizer, right? So what we are conducting in the evening are all appetizing sessions, and a good number of students are buying subscription, calling to the helpline. Thanks to all of you. And I also like to listen a good news from you as to how you have done, how you are getting really helped out by the video library. That's what I like to get the feedback down the line, right? So now the question is, very good. Rizwana Ali is proposing A, and Madhu is proposing A. Absolutely. Internal and external rotation is what you are checking. A patient presented with chronic low back pain. I know you cannot answer this question. Bet karenge kya? Chalo, dekhenge. Schober's test is positive. Spinal X-ray is being shown to you. Appearance of the patient is also given to you. What is the most likely diagnosis? Question number 18. Ritu thinks ochronosis. Satya Snigdha thinks ankylosing spondylitis. Vishalakshi, Radhika Pillai thinks ochronosis. Amrita ochronosis. Tanveer Sodhi is proposing ankylosing spondylitis. I know. Doc, this pigmentation is an important clue, Doc. I know you are all fascinated by the spine radiograph to answer ankylosing spondylitis, but it is ochronosis where you find also the pigmentation. Same ditto question. Don't tell me I leaked the paper. So irregular calcification, narrowing of the intervertebral discs are the classical features that you are able to see. अच्छा, इसका diagnosis बोलो डॉक्टर. फटाफट बोलना. Identify the phenomenon in the eye below. Yeah, shoot your answer. Yes. Wow, good to see 80 online students actively being part of the discussion. That's good. So Ritu Raj is saying entropion, Amrita also. But Subramani is proposing entropion. Very good, very good. When you become old, involutional entropion is very common, doctor. That's what you are able to see here. The involutional entropion. That's good. Which ophthalmological investigation is being done here? Is it a plantation tonometry? Is it patchimetry? Laser interferometry? B-mode ultrasound? What is this investigation which is being carried out? Yes. Question number 20. Yes. You should remember question number 20. Sarla, Radhika, Chandrakant, everyone is saying A. Very good. It is a plantation tonometry, which is the investigation which is being carried out. Abhi batana, doctor. Looking at this lesion, looking at this visual field issue, what is the location of the lesion? Is it optic tract, optic radiation, optic chiasma, lateral geniculate body? One question, doctor, invariably they will ask on visual field defects. You cannot be able to do wrong of this question. Yes. So, Radhika Pillai is proposing optic chiasma. Lawrence thinks optic chiasma. Sarla thinks optic chiasma. Badhiya. So, very good. So, it is classically bitemporal hemianopia. This is one important thing बहुत बार डिस्कस किए, फिर भी जितने बार डिस्कस करो, this PPT slide should directly go into your mind. So I'm going to invest a bit of the time. Though this is a quiz session, I like to spend some time to discuss this, doctor. Now, you have a central scotoma. Central scotoma, if there is any lesion which is happening in the retina, right? Then, if the optic nerve is totally cut off, then what do you have? You have a monocular vision loss, one eye blocked. If the optic chiasma is affected, then you get bitemporal hemianopia. Why? In the optic chiasma, typically the temporal fibers are crossing. Temporal fibers are crossing. And, nasal fibers are crossing. Nasal fibers are receiving the vision from the temporal field. So if the nasal fiber on both the sides are affected in optic chiasmal lesion, both the sides temporal fields are affected. That is the reason you get bitemporal hemianopia when the optic chiasma is affected. Then, whenever there is any problem in the optic tract, or if there is any problem in the optic radiation, or if there is any problem in the much posterior to that, then you get a contralateral homonymous hemianopia. One side nasal, other side temporal. Then, if there is any problem in in this optic radiation area, or if there is any problem much posterior to that, then you get contralateral superior quadrant anopia. Similarly, there are two kinds: temporal, parietal part of the optic radiation. Accordingly, superior, inferior quadrant anopia, contralaterally you will be getting. So ultimately, if in the visual cortex where the posterior cerebral artery supplies, if there is any lesion, then you get a homonymous heminopia, but there is a macular sparing. This is the classical features which you have to remember every time. Examiner definitely asks one question from this visual field defects. Now, doctor, among these, which vessel is not ligated in case of epistaxis? Here, there is a vessel here, pointed here, A. Then there is a vessel which is being pointed here called B. And there is a vessel pointed here called C. Out of this, which vessel is not ligated if there is epistaxis, to control the epistaxis? Question number 22. Fatafat answer karo doc. Very good. Good to see 80 online students. Yes. So, Medical Marvel is proposing B. Tejal Parmar says B. Ranjit Shaw says C. Right? हाँ. एक साफ साफ बताओ. Internal carotid versus external carotid. Which one you ligate, which one you don't ligate? Simple way. So, what is being shown here as A is maxillary artery. That is ligated. Between B and C, B is internal carotid, C is external carotid. So that is the reason Manish Kumar rightly says, external को ligate करते हैं, internal को ligate नहीं करते. For the epistaxis is what you have to basically remember. Now, doc. Now, what is this line which is being marked on the face in this picture called as? Question number 23. Right? Common carotid to impossible hai, unless you want to kill the patient. Right? So, that's right. So, Chandrakant, Amrita, Parmar, Lawrence, everywhere. Ongren's line. Ongren's line is what you have to basically remember. Acha bhai, ek do comments on the Ongren's line. So typically, whenever there is any cancer in the maxillary sinus, then those cancers which are in the superior posterior aspect, they can easily invade into the eye and into the base of the skull and also into the pterygoids. So, Ongren's is that imaginary line which is drawn from the medial canthus to the angle of the mandible. And structures above this line are called suprastructures. Whereas those which are below this line are called infrastructures. And the malignant lesions which are involving the suprastructures, they carry worst prognosis. Worst prognosis. Whereas those which are below here, they carry good prognosis. That is called Ongren's line, is what you have to emphatically remember. Sweetie Ebenezer, for having had come to this evening class today, definitely understood what is the Ongren's line, right? So, in the onlinembbs.com, in the ENT, maxillary sinus, paranasal sinus carcinoma is one of the high yield topic. Please review 8 to 10 points should be there in your pocket. That is very, very important. So, once more, fatafat bolo, medial canthus of the eye towards the angle of mandible you draw, any suprastructure bad prognosis, infrastructure good prognosis, that is what you have to basically understand. Now doc, this is an easy question. आप फटाफट आंसर कर सकते हैं. Question number 24. Audiogram of a 30-year-old female is being given. What is the most likely diagnosis? फटाफट बोलो. That's right. Good. Himasagar is proposing noise-induced hearing loss. मंगेश ने अर्जुन के जैसे 2000 हर्ट्ज देख के खेराट नॉच को पकड़ लिया. That is how you have to play the cricket. Satya, otosclerosis. Very good. Everyone absolutely correct. No, sweetie, I'm happy. There is no guarantee, there is no need that we need to know everything. हम सब MBBS पास होते. कुछ topics, some topics we are not good. We are not good means we did not study. That's the only thing. अभी क्या है? The purpose of the next 5 months of our journey, identify those topics where we are lagging behind because of our interactions, answering wrongly the questions, and then go and quickly correct. That's all. There is no rocket science. Everyone wins the PG medical entrance, right? Only thing is you need to correct quickly those topics, right? Very good. Chandrakant rightly says, noise-induced hearing loss जो होता है 4000 hertz के ऊपर होता है. That is very important. So this is how a typical pure tone audiogram, early stage, late stage. So late stage में typically this is how it looks like. Early stage में this is how it looks like. So that brings us to the end of the quiz today, doctor.